Okay, so welcome everyone. My name is Ari Maharaj. I'm NEDIC's Outreach and Education Coordinator, and I'm thrilled today to welcome Sarah Santarossa all the way from Windsor, Ontario, and she's going to be doing a webinar for us on orthorexia. Orthorexia is actually something that's super interesting because it's one of the topics that has been requested by many of you over email. In addition, orthorexia has been something that when we're out in the school community talking to students, teachers, and educators, um, that comes up, whether it's the concept of clean eating, whether orthorexia is a real thing or whether it's an eating disorder. Those are all elements that have come up. So we're really excited to have Sarah join us for this webinar. She's already submitted a bulletin for us, and if you were subscribed to the NEDIC bulletin, and we're excited to have her expand on that topic, and we'll be sure to send out that bulletin to everyone afterwards as well. I'm seeing some notes in the comments that Sarah's a little bit blurry, and she is a little bit blurry, and that's how it'll be right now. But we're hoping that we know that her sound is going to be really good, and the slides that she'll speak to should be able to capture everyone's attention. So feel free to continue to message in the chat, and I'll be around to answer any technical questions as we continue to go. But I'm going to turn off my webcam and pass everything over to Sarah. So thank you, Sarah.
Okay, thank you. I just wanted to start off with saying that I'm really excited to be doing this webinar today. And I appreciate this opportunity to talk about this topic and share some information with you. So let's get started. And I wanted to start with a quote that I took off of an individual's blog who I know personally who is dealing with orthorexia. So she wrote, "I love to bake, and I would bake a whole tray of vegan, gluten-free, refined sugar-free muffins, snap a pic for my blog, then eat the whole tray and think that I was fine. It was healthy. I became obsessed about my diet to the point where I isolated myself. I had orthorexia." So today we're talking about orthorexia, and I thought the title for this would be fitting, Healthy Eating Gone Too Far. And we'll talk about that distinction between wanting to eat nutrient-dense food and where does that end and orthorexia begin. So a little bit about myself. I'm a PhD candidate in kinesiology at the University of Windsor, and my main focus of my research is really how social media influences things like body image, self-esteem, eating behaviors, and eating disorders. And I think knowledge translation is and exchange is really important, and that's why I'm very excited to be doing this webinar today. My belief in the importance of knowledge exchange has led me to work with a number of community organizations, one of those being BANA, which is the Bulimia Anorexia Nervosa Association here in Windsor. And I have been really fortunate to be able to work with BANA and gain exposure for the research that we're doing. So this leads me to today's topic, orthorexia. And before I give you an outline for the workshop, I thought it would be important to discuss my connection with orthorexia. So some of my research has used a software called Netlytic. So this is a software that allows you to collect mass amounts of data around a particular hashtag. And if you're not familiar with social media, a hashtag is used to connect a group of people around a certain interest or a topic online. So we had looked at things like hashtag no filter. So this would be putting a picture and saying you're not using a filter on it. Hashtag selfie, hashtag inspiration, which is this idea of fitness and inspiration and inspiring people through photographs. However, a few years ago, an undergraduate student came to me with this idea to look at hashtag orthorexia on Instagram. And I had never heard of this term. What was orthorexia? I said to her. Um, so this student got out her phone and started showing me all of the hashtag orthorexia posts on Instagram. And this is where I got really interested in the area. So we developed a game plan to investigate the hashtag orthorexia conversation on Instagram using the software, but also to look at the images. What were these people posting and who were these people? So we also wanted to look at their Instagram profiles and biographies. So I'll discuss the actual results of the study later, but this work was published recently in Eating and Weight Disorders, Studies on Anorexia, Bulimia, and Obesity. And from there, it kind of took off. I had an interview with CTV The National, which was really exciting, and some other local media outlets, and now this webinar. So I don't consider myself an expert in orthorexia, but through the research that I have done, I'm really hoping to provide you today with some useful information and practical tips that I hope you can apply to your own life, work, practice, or those whom you interact with. What will we be talking about today? So I thought I'd pose the outline using a series of questions. So we'll be, what is orthorexia? What's the difference between just wanting to eat healthy and orthorexia? Assessing, diagnosing, who's at risk? What are some warning signs? What can we look out for? The causes of social media, or the causes of orthorexia in relation to social media as an environmental factor or influencer. And then are there treatments that exist? And what are some next steps that we should look at or that are happening? So orthorexia is a form of disordered eating that's gaining momentum today. So Dr. Stephen Bratman coined the term in 1997, and though the disorder is not clinically recognized as an eating disorder in the Diagnostic and Statistical Manual of Mental Disorders, so the DSM, nor was it originally intended for an eating disorder, many experts today are now taking notice. And we'll see how social media has kind of influenced how it's being conceptualized and gaining popularity or interest. So I wanted to put this table up here for you just because this is what's being used in the literature as criteria for orthorexia, but I just wanted to summarize it. So there isn't any official diagnostic criteria, and there actually isn't even a universal or shared definition that currently exists, but there are key elements that researchers and practitioners agree on. So these elements include an obsessive focus on dietary practices believed to promote optimum well-being through healthy eating. So they're inflexible with these dietary rules. They're recurrent and persistent, and there's preoccupations related to food, and there's this compulsive behavior to eat healthy. Consequently, there's clinically significant impairments. So there can be medical or psychological complications, great distress, or impairment in important areas of functioning. So we're going to talk about some case studies later on, but even that example I talked about in the beginning, she felt isolated, she felt alone, and you'll see like this orthorexia can influence activities of daily living. So orthorexics focus on the quality of the food over the idea of quantity. So the focus here is really on quality. and they feel a sense of righteousness when consuming this type of food. They have an idea or a sense that there's a perceived danger of foods with artificial substances. There's a danger if food was prepared with the use of herbicides or pesticides. They may avoid certain food groups, so totally cutting out carbohydrates and fats. And then maintaining the diet becomes the main priority of the individual, and this results in neglect in other areas of life. But where does healthful eating end and orthorexia begin? So, like you said at the beginning, wanting to eat more nutrient dense food is not the problem. And Bratman noted that orthorexia has two stages. The first is simply choosing to eat a healthful diet. The second is an intensification of that pursuit into unhealthy obsession. He cautioned that simply adopting an alternative diet, whether it be based on science or pseudoscience, does not mean someone has orthorexia. Eating doesn't become pathological until it becomes entangled with obsessive thinking, compulsive and ritualistic behavior, and self-punishment. Orthorexia begins when the intention to eat healthy becomes this unhealthy obsession, and there's this psychological torment to eat healthy food. Individuals with orthorexia often use a diet to achieve a feeling of perfection, purity, or superiority, and may feel judgmental towards those who don't follow this similar healthful diet. Their eating can result in social isolation, impaired quality of life, malnutrition, and extreme weight loss. And from here, if the diet is too restricted, it can lead to nutritional deficiencies and health complications. And we're going to talk about some case studies in just a couple slides. But how do we assess or diagnose orthorexia? So orthorexia is being studied all over the world and in various capacities. So I've put up a couple topics here on this slide that you may see in the research or in different articles online. But just to give you a sense, there's studies coming out of Portugal, Spain, Hungary, the United States, Great Britain, all over the world. But one of the difficulties with assessing the prevalence of orthorexia in the general population or within a specific population is that there's no consensus on the definition, which we talked about. There's no universal definition, and there's no validated assessment tool. So I'm going to give you two examples of tools that are being used, but there are some problems with them. So the first one, and the one that's most cited in the literature, is the Ortho 15, but it's been highly criticized because what happens is the Ortho 15 has been translated into multiple languages for different countries. We know this research is going on all over the world. So those researchers will adapt the questionnaire or the survey in their country. They not only change the language, but they may also remove some of the questions that appear in the original scale. So this can become really problematic when we're trying to compare data across different research studies and pull out those prevalence numbers. So it's been suggested that literature that uses this scale, we really need to proceed with caution when we're reporting the results or using it to compare to other studies. Most recently, however, a new scale is being used. So this scale, this study actually just came out a couple months ago, which is really interesting and exciting. And what's great about this scale is that it's looking deeper into orthorexia and it's assessing this bidimensional nature of orthorexia. So it believes that it's important to tease apart this idea of the interest in healthy eating, or what they're calling healthy orthorexia, that can be seen as a more positive dimension, where a healthy interest in diet, healthy behavior with regard to diet and healthy eating is a part of one's identity, versus what they're calling this pathological preoccupation, or orthorexia nervosa. So this is that compulsive obsession with healthy eating. And in this study, what they found is that the orthorexia nervosa was the only dimension of orthorexia that was related to negative affect and the fear of not eating healthily enough. So it's the orthorexia nervosa component that is psychological and can cause distress and impairment in everyday life. So this healthy orthorexia, the food choice motives were more based on health content, whereas the motives for food choice with orthorexia nervosa were based on weight control. So there were definitely seeing a difference, and it'll be interesting to see what future research studies show with using this scale. So although I just mentioned determining a prevalence in orthorexia is difficult because there isn't an agreed upon diagnostic tool, um, some of the research focuses on whether dietitians and other health professionals are more prone to developing orthorexia. And you can think of this because they're, constantly involved in this world of food and health. Um, and there's actually a study that came out suggesting that nutrition students have higher rates of orthorexia eating behaviors or patterns than other academic disciplines, and that they're at a particularly high risk due to the nature of this work. So this may be many of you in this webinar today. And I know when I first heard the term orthorexia, I thought to myself, where does that distinction between wanting to eat healthy or those nutrient dense foods and this begin? So really focusing on that it is a psychological or pathological obsession with eating healthy food, and it's causing those impairments in this person's everyday life. So although orthorexia is in its infancy, our early understanding of the disease has suggested that orthorexia presents itself differently between individuals. So when we talk about treatment ideas, or it's very individualized and will depend person to person, as with many other disorders or diseases. But what's important to note is that there has been outcomes of serious physical health issues in orthorexia eating disorders. And I'm going to share a couple of those that have actually been published as case studies. So the first one was a 30-year-old male, and he presented with general weakness and drowsiness when he went to the hospital. And upon the doctors, doing their history check with this patient, they discovered that he had eaten only 3 to 4 spoons of brown rice and fresh vegetables without salt for 3 months. That was his only diet, all he consumed. And they gave him the diagnosis of orthorexia nervosa because he was also presenting with hyponatremia. He had a pneumothorax, which is a collapsed lung, and problems with the way his blood cells were being created. So there were a lot of medical complications that were coming along with with his presentation of this orthorexia behavior. Our second case is a 33-year-old female, and this was really interesting because they suggested that her orthorexia represented an early sign or symptom for the development of schizophrenia. So she had 7 years of pursuing an exclusive diet of only raw and fresh fruit, vegetables, and raw eggs. So she was diagnosed with paranoid schizophrenia, and at the time of her admission at the hospital, her BMI was 14.5. So although BMI may not always be the best measurement, if you're unfamiliar with the scale, BMI of 14.5 is severely underweight, is classified as severely underweight. But she did not have any other metabolic or biochemical abnormalities like in our previous case study. So we see it presenting differently from individual to individual. Finally, another example here is of a 37-year-old female. So doctors first diagnosed her with anorexia nervosa, but she really resisted this diagnosis and the treatment that went along with it because she thought it didn't fit. She didn't think it was right. She didn't want to be thin. She just wanted to eat healthy food. So through cleansing and only wanting to consume the quality, remember, is what's important. So that purity, the food purity, she brought her weight down so low that she died of heart failure brought on by orthorexia-induced starvation. So just 3 examples that were in the literature that really show variation in the disease and how it can present differently between individuals. So, I mean, we've already talked about some warning signs or what is orthorexia and what it looks like, but I tried to compile a list of warning signs from WebMD, NEDIC, and NEDA, which is the National Eating Disorders Association. So I'm going to present about 7 warning signs and just kind of expand on them each a bit, but it's just a good compilation of what's being said across these different organizations and trying to put it all together. So really at its core, orthorexia will consist of following an arbitrary set of rules. So they're avoiding certain ingredients, they're not trusting others to prepare their food. But again, these rules and how orthorexia looks can be really different for everyone. So they're spending hours thinking about food. There's this preoccupation with food, and some sources have even said that they're thinking about food and food preparation for more than 3 hours a day. So they put a tangible number on that. Skipping foods or cutting out an increased number of food. So of food groups, so all sugar, all carbs, all dairy, all meat, all animal products. And there's this inability to eat anything but this narrow group of foods that they have deemed healthy or pure. And then there's the feelings of guilt associated with not following this diet or these rules that you have created for yourself. And then feelings of isolation, and you're maybe not going to those family events because you don't know what food is going to be prepared or who's preparing the food, and you're preoccupied with thinking about what food might be served at those upcoming events, and that becomes stressful. So some research is showing that there's a self-esteem boost from eating healthy. So they're feeling superior, and we talked a little bit about earlier how they'll be very judgmental towards people who aren't following these same sets of rules or eating behaviors as them. But it appears that body image concerns may or may not be present. Um, and that they're feeling really virtuous about the food that they're eating, and not worried about the pleasure in eating, or the pleasure that they get out of the food. And there's also an increase in concern about the health of ingredients, compulsive checking of ingredient lists, and nutrition labels. So they're becoming stricter with themselves. And the point that I think is really interesting is this obsessive following of food, and like these healthy lifestyle social influencers on social media. So we'll talk a little bit about that as a potential cause or a way that it's being framed. So, what causes orthorexia? Or are there possible causes? Are there a set of causes? So, again, there remains to be a consensus among clinicians and researchers. And in fact, there's even a debate around the legitimacy of orthorexia as being a standalone disorder or disease. And that's why I thought this Venn diagram would be important to show everyone, because there's this idea that there's characteristics of orthorexia that overlap with other eating disorders and OCD, or obsessive compulsive disorder. And again, there's this debate as to if orthorexia is just a variant of an existing disorder. Is it a coping strategy for an existing disorder, or is it just a lifestyle? So that star there in the middle, though that list is where there's an intersection or an overlap of these three areas, and it's causing this debate as to whether orthorexia should be standalone and have its own criteria in the DSM. However, there are environmental factors that have been said to influence eating behaviors, and thus like conceptualize the idea of orthorexia and this is the media as one of the main environmental factors that we'll be talking about. So for example, the media has this power to create fear around things. So for example, fear around contaminated food, such as chicken or fish. So for somebody who has those orthorexic tendencies, this can be really scary. There's a pressure for people to pay more attention to healthy or clean food. The media can create a culture. It enables people to choose healthy food, while it's also, on the other hand, promoting the prevention of obesity. Right, so we're pushing consume healthy, and we're scaring this idea of obesity. And then there's also a power in creating obsession with health and healthy food. If it's constantly being put in our face, there's really this control that the media has to influence us and our behaviors. So more recently, a new wave of media, such as the internet or social media, have been implicated in increasing the prevalence of eating disorders. But in particular, social media, there's this increased connectedness, which can help and hurt those suffering from an eating disorder. So, on one hand, social media can create a space for like minded individuals. Perhaps these were people in the past who were suffering alone or didn't have the support they needed or the understanding. And now they have this ability to create these connections. However, it could also be very dangerous or a hurtful environment where that support may be directed towards unhealthy behaviors. So many people use social media to seek advice about food, and a lot of people are sharing or what we're calling like food photography. So it's very common and popular for individuals to post images or other content about what they're eating, what products they're using, etc. So social media then becomes this really powerful transmitter of ideas about weight, shape, appearance, and our behavior because it merges the influence of media, peers, and family. And it really does foster this environment for social comparison. So there's a lot of social media influencers online that individuals follow and we're taking very seriously. So when we see somebody's life or what they're eating, we compare our own life, our food, and it creates this pattern or a need of wanting to fit in to the certain online persona and be a part of that community or those people. So recent research has suggested specifically that high Instagram use compared to other social media platforms is associated with an increase in orthorexia symptoms. So it could be that Instagram has a stronger relationship with orthorexia compared to other platforms because it's very content or image based. So social media users were more likely to remember pictures than words. So if you have Instagram, you know your feed is full of things that you're interested in, or that these apps are so smart, they'll send you sponsored ads or post things that you are thinking about, but you don't know they know that you're thinking about it, and it comes up on your feed and then it's generating this cycle and you're engulfed in this content. And it really is shaping how you think and you feel. So in addition to this, the use of hashtags that are in captions or within the comments of Instagram posts can be used to create that culture or community, connecting people and influencing social norms. So as I mentioned earlier, we had done a study on hashtag orthorexia to examine that conversation to see what people were talking about, what were the images, who were the authors. So I'll share some of those results with you. And the findings were actually really interesting and totally opposite to what we had hypothesized. Orthorexia in their conversation. And this is just over a 1 week time span that we collected this data. What we found is that most of the conversation had to do with good feelings. So that's what that graph is there. And you'll see that's a content analysis of the conversation. So words like happy, love, that, synonyms for good feelings would fit in there. And the conversation really focused on eating disorder recovery and love, which was very opposite as to what we had hypothesized because based on other research with other eating disorders, we really thought there would be a community promoting the disordered eating behavior because that's what has been seen in the past, but that wasn't the case for orthorexia, which we find very interesting and really means that more research is needed. Of course, majority of the images were of food, so people were posting what they were eating or their meal plans. And ideas from this study may be used as a combative tool, and perhaps Instagram can be leveraged to encourage recovery and the adoption of positive eating behaviors. So just a couple findings that I thought were interesting to share with you. all and learn about that conversation that's happening on social media. And because social media and the media has played this part in conceptualizing orthorexia and making it a popular topic among people today, I think it's important to look at some preventative measures for orthorexic behaviors on social media. So, what can we do on social media or through our own social media to help prevent the development of these types of behaviors? So, these tips and tricks were a collaboration or a modification from some of Nedic's tips, and then also Bana. When they give a community presentation, they do hashtag stay positive online. And so this is some of the points that are taken from there as well. So doing the social media audit, encouraging that you're following a diverse number of social media accounts, you're avoiding consistent presentation of that clean eating images and captions. So go through your social media and maybe you started following something for a contest or to win something, and that hashtag is now appearing all the time. So you can unfollow and you have some control over that. And then looking at what are you posting? What is the message or persona that you're creating as like a health promoter, as a teacher, as a parent, or as a positive influencer in this community or in your community? You have the power to put certain messages or personas out there online. So, what are you doing to discourage dieting as a practice? How are your images or your content being perceived by other individuals? So, just something to think about and go through your own social media, and avoid placing food into categories, but also think about the pictures and the images that you're putting up there. So there's this call or a need for more real world food photos. So maybe it's, you reheated your pizza for lunch, and that's what you're having, or maybe you are posting that salad because it really is truly delicious and you want to share that with your followers. But thinking about being real and realizing too that the people you follow oftentimes are only putting their best foot forward or the best parts of their day online. So think about that in terms of food as well. We want to avoid language that intentionally or unintentionally validates dieting behaviors. So words are really important, and that's spoken or on text or online as well. So our own hashtags and captions, we want to avoid those morally loaded terms such as a cheat day or clean eating, detox, guilt-free, low-cal, diet, words like that. We're avoiding those in our own posts. We also want to work towards building like these safe communities that are accepting of all body sizes to reduce perceived need to engage in orthorexic and dieting behaviors. So you can block certain individuals or images. I do this all the time. Like if I see something that's promoting an unhealthy behavior, you can block that as a user or report it. And then also on a positive note, support those positive influencers who do have those messages that you believe in and that you support and you think that need to be heard online. So those are just a couple of tips and tricks to think about or consider or share with others because we know social media is so important. And I wanted to show you just a takeaway. I'm not sure what everybody in this webinar does in their professional life. I'm sure there's some clinicians, researchers, educators, but this was actually a teacher who we did a presentation in her class, and she took our messaging about like creating this body positive space on social media, and she had her students create an Instagram feed that they felt relayed the messaging that came through in the presentation. So I thought these were really great and just wanted to share them as a potential activity or idea. But we've also done like group discussions and having the conversation about how social media influences us and our eating behaviors, I think is really important, especially because a lot of young children are online despite age restrictions. So really being in tune to how this is shaping and molding how we think and feel and our values, beliefs, and attitudes. So moving away from social media as an environmental factor for orthorexia, I wanted to talk a little bit about possible treatments or the treatment that has been, documented within the literature. So according to NEDA, which again is the National Eating Disorders Association, no clinical treatments have been developed specifically for orthorexia, but many eating disorder experts treat orthorexia as a variety of anorexia or OCD, which we looked at in that Venn diagram because there is that overlap. So treatment usually involves psychotherapy to increase the variety of foods eaten and exposure to anxiety provoking or feared foods, as well as weight restoration as needed. And I put the thumbprint there just because as a reminder that there's a need to individualize treatment and that everybody's situation is unique and different, and that typically treatment will require a multidisciplinary team approach. So this can include psychiatrists, psychologists, physicians, and dietitians. There's also some literature that suggests incorporating mindfulness, intuitive eating, generally balanced eating patterns, and when appropriate, apply the necessary medical nutrition therapy recommendations, all with a gentle, compassionate approach in assisting in changing these habits. And what I found really interesting is that most of the patients or the clients with undiagnosed eating disorders are under the care of a clinical dietitian. So knowing how to correctly address this dysfunctional eating behavior is really critical. So if a dietitian doesn't pick up on the patient's anxiety about eating or misinterprets that anxiety as enthusiasm or motivation to eat well, nutrition education can contribute to these unhealthy obsessions and fears about food and lead to orthorexic behaviors. So some of the tips for dietitians include caution in using vague words such as avoid and eliminate, because for those individuals who may be suffering from orthorexia, that could mean zero tolerance to them, and they could see that in a really negative way. So finding more morally neutral ways to communicate nutrition information is really important. Finally, some next steps in the world of orthorexia. So I thought this would be important, just seeing where things are going moving forward, since this is such a new area. Like 70% of the research has been done in the last 5 years. So you really get a sense of this is in its infancy, and there's lots of room for growth and understanding. So in March of 2018, there was actually an international task force that was created to advocate for the inclusion of orthorexia in the next version of the DSM. So they convened to discuss proposed diagnostic criteria. So I tried to find any updates from this task force of March of last year. However, nothing has been published online about how things are moving forward, but hopefully some documentation comes out soon so we're able to see what types of like leaps and bounds or ideas have been made in this area. So I think that's really exciting for that discourse or discussion. Um, in addition, I just wanted to provide like a summary of what type of research is needed moving forward in this area. So like I said, 70% of the literature has been done in the last 5 years. So there's there's this abundancy of non-academic and gray literature through blogs or web posts or news reports, but there is a need for researchers to look further into this area so we can move forward appropriately with understanding it further. And that is all the content that I have for you today, which is exciting because then we can get to some questions that hopefully I'm able to answer for you all. So there were some questions that I received ahead of time that I'm thinking some I may have answered through the presentation. So there were a couple questions on prevalence, um, specifically in regards to the elderly population and with children as well. So as we discussed, like determining the prevalence is really difficult without a diagnostic tool. I did come across some of that gray literature, those blogs, where there was a case study or an example of an individual who was 73 years old and he was suffering with these orthorexic behaviors. But again, it is really difficult to establish the prevalence in the general population, in specific populations, just based on not having that agreed upon diagnostic criteria. In terms of children, I thought that was really interesting, just because a lot of my research personally focuses on parent modeling and how parents influence like our psychosocial health and well-being. So although there isn't any documented literature that I could find on the prevalence of orthorexia in children, what I do think is important to note or as a takeaway is that um, parents or positive influencers really do play a role in developing eating behaviors and habits. And this can occur on and offline. So I know we talked a lot about social media today. So, for example, if I'm a mom or a teacher or an older sister, and I'm posting about my clean eating or my keto, whatever, using these hashtags and creating this diet culture. If my younger sibling or niece or nephew or my students or whoever is following me online is seeing those posts, that may influence the way that they think and feel about food and their own eating behaviors. So I think that's something to keep in mind and think about moving forward. There was also some questions on ethnicity, socioeconomic status, and culture, and if that played a role in the development of orthorexia. Um, because some of the literature has documented this more as like a rich white woman disorder or disease. And again, I hope based on the presentation that it came across that there needs to be more research in this area and that there's a gap in the literature in understanding the difference between individual groups or the population as a whole. Like really understanding that prevalence is difficult, but hopefully something that is explored with new diagnostic tools or assessments. There was also a question in regards to if a prevention program could be implemented specifically for orthorexia. And I think that's a really good question, and I'm not sure um, I have the answer. Do I think that something could be created? Yes. Have I read anything being created? No. I think something that incorporating media literacy would be really beneficial for the creation of a prevention program or an intervention. But I do think that really understanding how to diagnose or if it is going to be considered its own eating disorder or is it a pattern of behavior that occurs in individuals suffering with anorexia or OCD. So I think moving forward and understanding more about the behaviors and the causes and environmental factors that are driving orthorexia will help in how we can create and craft interventions moving forward. But I do think that media literacy is really important, and hopefully those social media takeaways will be helpful with the people who you interact with. I think that answers all of the pre-questions. I know there was a couple other ones, but I think they were covered. If not, I'm happy to expand on them as much as I can. And I know there's some questions in the chat, but you can let me know which ones to answer.
Yeah, so for Sarah, if you pop over to the chat, that's just me and you. I've copy pasted them there, so they're
Perfect.
yours.
Okay.
There's one from Isabel who asks, "What are your best suggestions to positively influence and prevent or promoting diet culture or eating disorders?" And I think you touched on that a little bit with that last answer. This was asked in the middle, but I'll echo from the NEDIC standpoint of when we're out in schools. These are middle schools or high schools talking about eating disorders and risk factors, where they're doing media literacy work with kids because the research on the sociocultural factors that influence eating disorders, media literacy programs have been shown to be one of our best bets at preventing eating disorders. We're also there, though, talking about things like body shaming or body based bullying, especially with young people, because usually maybe people feel like they have to change their body, and one way of doing that is dieting, is if people are shaming them about their body. So kind of making sure that young people know there are very real effects of shaming people for their body weight or their body size, and that people from of all body types can have intrinsic value and worth, and delivering that message, whether that's on social media through things like body positivity messaging, but also like in presentations and educational material for kids, is something I know we've been trying to do. Ben has been trying to do. NIDA in the States or BEAT in the UK. A lot of us within the eating disorder community have tried to rally behind that as one of the ways for prevention. But I don't know if you have other stuff to add on that piece.
I think that's a great answer. I think too it takes really it's hard to change the way that maybe you have always talked about food or even the way you when you see somebody and you instantly want to give them a compliment based on their appearance. So I think it takes a lot to make those changes in the words that you use. So I think that is something that you on an individual level can think about and try to implement in your own behavior. So focusing on those intrinsic qualities and promoting that body positivity, but really focusing on how you're speaking about food and other people and being mindful of that. I think is an important way. But your answer was great.
A lot of the like weight stigma we probably don't realize can come just from the language that we're using and what we're having in conversation. If that's like, oh, I need to go run home from the restaurant now, or you look great, have you lost weight? Like those are all things that immediately come to mind, probably because that's what our eyes are seeing. But usually that's not super helpful. And if we can change that to things that are based on someone's intrinsic value or things their body can let them do, or like someone's abilities or personalities. Can be something different. Isabel asks also
Absolutely.
if there are any favorite hashtags to use on Instagram that I'll post to you because I know you were doing the social media kind of content analysis. Are there any ones
Oh,
that you see?
that's a really good question. That's a great question, and I definitely could compile a list off the top of my head. Like hashtag body posy is a good one to look at. And what I think is really interesting is in my research, I feel like I'm focusing on the negative of social media a lot, but there is a lot of positive that can be done. Um, so that's a great question, and I'll definitely I can prepare a list of some good hashtags to follow. That's a great
Yeah,
question.
that'd be awesome. Julie added in Haze, like hashtag health at every size, if people don't know
Yeah.
where Haze is from. Um, and there are many others. Netic will try to, we can maybe work together, look to see if there's something we can do to put out some hashtags. But I know we've been a lot more mindful recently on Instagram of the kinds of things that we're putting out. Because we know that there are folks that are looking at our account almost as like a model for others too. So we're trying to be mindful as a role model. Um,
Yeah.
One of the other questions that came, and like it's okay if this answer isn't one that we know off the top of our head, but do we know why
Okay.
um, orthorexia wasn't included as a diagnosis in the DSM-5? Was it just like it was too recent of a phenomenon to kind of be included there? And that was from Raquel.
Yeah, I'm reading that question right now. That's a really good question. And what I found really interesting is that there's not a lot of information available on the task force itself. So, from what I've read, it was a push to put it in the next DSM. So I'm not sure. I wish they would have had some sort of like notes or compilation of what was discussed at the meeting available for the public, and that's not something I could find because I'd really love to share it with this group. So I'm not sure I can answer that question well. However, I will keep an eye out for if any. I want to see like conference proceedings come forward. That are showing what the next steps are. Because right now, all I could find were the individuals just taking ownership of being a part of the task force, but not actually discussing what the task force did or was doing.
Yeah, no, that's and ditto on our end. We've been anxiously kind of awaiting to see what kind of has happened, but we haven't seen much. And I think I was struck by when you said most of the research, 75% of the research, I think you said, has come out on orthorexia in the last 5 years. So something that is very, very recent and a phenomenon that I think we'll all keep our eye out for. And I think this is a good time, given that we only have 2 minutes left to end. And thank you for providing this vital education for us on orthorexia and really filling that gap. We really appreciate the kinds of knowledge that you've brought, especially kind of integrating social media use, which I know many of us across the country are always kind of talking about. Um, so thank you for your time and
Thank
your
you so much
expertise.
for having me. Thank you.
We'll make sure to post these slides and the recording. It'll be sent out to all registrants in addition to our webinars mailing list on the Netic YouTube. We'll make sure that references and all that are included where appropriate, and Sarah will send us a copy that's okay for downloading. So you'll have that information for you or for other folks in your organizations. But thank you so much for attending, and keep an eye out for our next webinar, likely at the end of May or start
Thank you
of
so
June.
much.
Thank you.
Bye.
Goodbye.